License, application, renewal, and conditional licenses. This section will provide you with the information on how to apply for a license, what the fees are, and the requirements. So, license application. Any individual desiring to obtain a license to operate an adult family care home shall file an adult family care home license application. The form is an ACA Form 3180-1022, which is incorporated by reference and may be obtained from the Assisted Living Unit Agency for Healthcare Administration. The completed application must be signed by the applicant, notarized, and submitted to the Assisted Living Unit at the address that is cited above. The application shall accompany by the following. Number 1, a completed Level 1 criminal history request. You can get the ACA Form 3110-002 for the applicant, each relief person, and all adult household members, and all staff. The form is incorporated by reference and available from the background screening unit at the Agency for Healthcare Administration. A check or money order must be submitted to cover the cost of each criminal history report. The completed form and screening fee will not be required for persons who comply with the requirements in Section 429.67. Number 2, a description and explanation of any exclusions, permanent suspensions, or involuntary terminations of the applicant from the Medicaid or Medicare programs or any other governmental healthcare or health insurance program. Number 3, if located in an area zoned single-family or multifamily, a community residential home certification form signed by the Department of Children and Family Services District Community Residential Home Coordinator. If it's not located in an area zoned single, multifamily, the local zoning form, which is ACA Form 3180-1021, which is incorporated by reference, or a letter from the local zoning authority signed by the county zoning official, which states that the applicant is in compliance with local zoning ordinances. So I definitely would go down and talk to your local zoning for your city and make sure that the home that you are considering buying or renting is, they're going to allow this adult family care home in it, and they'll sign off on the paperwork. Number 4, documentation of a satisfactory sanitation inspection. So that's the health department. Number 5, documentation of a satisfactory fire inspection, and that'll be your fire inspection. They'll inspect all your equipment and your elopement and fire drills. Number 6, income and expense statement, which will be on the ACA Form 3180-1017. That is usually prepared by your accountant. If you need help with that, reach out to us and we can refer you to someone. It is something that you can do yourself, but definitely the income and expense statement is, you want to make sure it passes through the first time. Number 7, written assurance affirming that the applicant is aware of and will complete the training requirements. You can find the training requirements in 59A-37.007, and we will get to that a little bit later in this course. You have a licensing fee of $100, documentation that the provider resides in the adult family care home, and during the licensing process, the agency shall, number 1, conduct a Level 1 background screening on the applicant, all adult household members, each relief person, and all staff. Number 2, conduct an on-site survey of the prospective AFCH, and during the survey, the agency shall A, visibly inspect all rooms and outside grounds of the home and determine that the home meets the minimum physical site requirements, which we'll get into a little bit later, and prior to the resident occupancy, and determine the capacity of the home. C, all deficiencies identified during the survey must be corrected prior to issuance of a license. D, if at any time of applying for initial license, an applicant is already providing room and board to one or more personal services to persons who will be considered residents, the provider must be in compliance with all admission and care standards applicable to residents under the rule chapter upon licensing. So make sure too, when you're getting your inspection, that your home is clean, the furniture is free of stains, that doesn't have any tears, it's in newer, nice condition. Really inspect your grounds and do a walkthrough, because those are things they'll be looking for. Number 2, license renewal. The agency annually provide an application form for a license renewal, the ACA Form 3180-1022. So they're going to provide it to you either electronically or by mail delivery to the AFCH providers at least 120 days prior to the expiration of the current license. The provider shall mail or hand deliver the license renewal application to the agency at the address cited, a minimum of 90 days prior to the expiration date appearing on the current license. B. In addition to the ACA Form 3180-1022, all applicants for license renewal shall provide the following. Number 1, documentation of a satisfactory sanitary inspection, which is the health department. And keep in mind, when you're requesting these inspections, sometimes they don't come out right away, so you need to plan for that too. Documentation of a satisfactory sanitary inspection shall be provided at the time of the agency's annual survey. In addition, a copy of the annual sanitary inspection report shall be submitted no later than 30 calendar days after the date of the inspection to the assisted living unit at the address cited in this paragraph, and failure to comply with this requirement shall result in administrative enforcement. So make sure that you're writing these dates down and keeping some sort of a log. That way you don't miss important renewal information, like the 30 calendar days, different things like that that are going to come up through your licensing period, and you don't want to fall out of compliance. Number 2, documentation of a satisfactory fire safety inspection report. So the documentation of a safety fire inspection shall be provided at the time of the agency's annual survey. In addition, a copy of the annual fire safety inspection report shall be submitted no later than 30 calendar days after the date of the inspection to the assisted living unit at the address cited below, and failure to comply with this requirement shall result in administrative enforcement. So there is another inspection report that you have to submit within the 30 calendar days, so write that on your list. Number 3, a licensing fee of $100 or $150 if it's not filed 90 days prior to the license expiration date. So they will increase the application fee if you are not on time. Number 4, documentation pursuant to subparagraph of this rule. C. During the license renewal process, the agency they're going to conduct an on-site survey of the AFCH, and during the survey, the agency shall visually inspect all rooms and outside grounds of the home and determine that the home meets the minimum physical site requirements, and the agency shall refer all safety and sanitation concerns to the county health department and the fire safety concerns to the local authority with jurisdiction over the fire safety. So they'll also be looking over those things. They're not going to do a thorough inspection like the health department of fire inspection, but just know that they can call things out and have them come out and re-inspect too. B, they're going to verify that residents meet the criteria for continued residency in an AFCH and that resident services are being provided in accordance with the standards established. So what that means is they're going to look at your residents, make sure they're appropriate to have be in your facility. If they're not, make sure they're not bedridden, that they're able to assist with the functions of daily living. Make sure that they don't need a higher level care facility, so they'll be looking and evaluating that too. They're going to verify the AFCH's providers complying with all facility, staff, and resident records requirements. So that's going to make sure that you have all your training in place, all your TB test, background screening, applications, your files are going to be complete. So I definitely recommend doing an audit of those every month, making sure that something doesn't fall behind. Number 2, obtain information from the district long-term ombuds council regarding complaints and whether complaints have been successfully resolved. Number 3, request documentation of adequate financial resources to operate the AFCH home in compliance with the health and safety standards if the financial stability of the AFCH is in question. Indicators of financial instability are filing bankruptcy, issuance of checks returned for insufficient funds, non-payment of rent, mortgage, utilities, staff wages or salaries or taxes, confirmed complaints to the agency or ombudsman counsel regarding withholding of funds or refunds due to residents, and any other information which indicates the inability of the home to meet its financial responsibilities in a full and timely manner. Number 3, conditional license. The agency may issue a conditional license to an AFCH if, at the time of license renewal, the facility is found to have uncorrected violations. A. The issuance of a conditional license shall be contingent upon agency approval of a written plan of correction, which includes corrective steps that will be taken to eliminate the deficiencies and a timetable for correction of the deficiencies by the expiration date of the conditional license. B. A conditional license shall be issued by the agency only for that time period necessary to comply with applicable licensing standards and complete license renewal procedures, but not to exceed 6 months. C. A conditional license shall be revoked and license denied if subsequent follow-up surveys by the agency indicate that necessary progress has not been made towards compliance with licensing standards. D. The issuance of a conditional license does not change the annual license expiration date. And 4. License denial. Applicants and providers denied a license shall be notified by the agency of their right to appeal the denial of the license, the remedies available, and the time limit for requesting such remedies as provided under Rule 59-1.024. So if you find yourself getting into trouble with your licenses and renewals and you have deficiencies, definitely reach out to a consultant, and you can call us and we can refer you to someone that'll help you get back in where you need to be. You may even need to hire an attorney. 59A-37.003 License Requirements. Number 1, the license time frame. Except for conditional licenses, all AFCH licenses shall be effective for 2 years from the date of issuance. Number 2, license conditions. A license to operate an AFCH is not transferable and is valid only for the provider named, the capacity stated, and premises described on the license. A change of ownership is prohibited. Number 3, voluntary closure. The license provider shall give at least 60 days written notice of any intent to voluntarily close a currently licensed AFCH to the ACA Assisted Living Unit. Each resident or residence representative and case managers of the OSS recipients. Number 4, license capacity. A. There shall be no more than 5 residents in any AFCH. The number of residents permitted in a particular adult family care home will be determined by the agency based upon the fire safety standards in compliance with physical site standards. An increase in capacity may not be made without the prior approval of the agency. B. Adult relatives of the provider who require personal care and supervision and reside in the home for more than 30 days shall be considered residents only for the purpose of determining capacity. C. Except homes licensed as adult foster homes or adult congregate living facilities, each AFCH must designate at least one licensed space for a resident receiving OSS. Number 5, advertising. A licensed adult family care home may advertise accommodations and services consistent with its license. The AFCH may not be listed in the Yellow Pages or the telephone directory under the heading of nursing home or assisted living facility. And that just is because those are different types of licenses, so it's just saying you have to stay within your license. You can't be misleading and list under nursing home or assisted living because you're not licensed that way. An advertisement for an adult family care home must indicate the term adult family care home and the home's license, number. An AFCH claiming to provide special care for persons with Alzheimer's disease or other related dementias must disclose these special care services in any advertisement or in a separate document which shall be distributed to the public upon request. Number 6, posting of information. For the purpose of the resident's ability to lodge complaints, the AFCH licensee or designee must post the address and toll-free telephone numbers for the following entities in full view in a common area accessible to all residents. A, the Ombudsman Council. B, the Advocacy Center for Persons with Disabilities. C, your Florida Local Advocacy Council. D, Agency Consumer Hotline. And E, the Florida Abuse Hotline. This can easily be put right in the initial walkway on a bulletin board. We had ours at our assisted living. We had a big cork board and we put all the different posters and phone numbers, and make sure that they are also eye level for people who are in wheelchairs. So you don't want to get in trouble for something like that. You can't put them way up high on the wall. Think about your wheelchair people and making it eye level and accessible for them.